Hi, I'm Savannah. I'm going to be doing my IV med push today. First things first, I'm going to make sure I follow GPSP, 11 rights, and 3 checks. I'm going to get my medication, check it with my MAR, make sure I do my 3 checks. I'm going to go in and identify my patient using 2 patient identifiers. I'm then going to ask the patient if they have any allergies. They said no. So first thing I'm going to do is I'm going to do all that, and then I'm going to perform hand hygiene and put on some clean gloves. Okay. Alright. So now that I have my gloves on, I'm going to go ahead and assess my IV site. I'm going to make sure that there's no redness, no swelling, there's no complications. It's connected to, my J-loop right now is connected to IV, like an IV bag, but we're going to disconnect that. Oh, and I'm going to choose the port that is closest to the patient. The J-loop happens to be the closest, so that's what we're going to use. So I'm going to disconnect that. And I'm going to clean the hub. And first things first is I'm going to take a normal saline flush. And I'm going to attach it, and I'm going to pull back, check for blood return. I did get it, so then I'm going to flush to make sure that the IV site is good, uncomplicated, has good blood flow. I'm going to slowly flush that, approximately about a minute long. I'm going to flush the flush everything. So then I'm going to disconnect that flush, and I would throw it away or get rid of it. But it's the only flush I have in front of me right now, so I'm just going to pretend I threw that one away and that this is a completely new one. So now I'm going to get my medication. I'm going to clean the hub, and then going to attach my medication and slowly give my medication, basically just as slow as I gave the flush, so about over 1 minute. Okay. And while I'm giving this medication, I'm going to make sure the patient isn't having any complications, reactions, that the IV site is not having any problems. So disconnect that. Then I'm going to scrub the hub again. Get a new flush. And attach it. And the same thing again, I'm going to flush slowly, just like I did the medication, all while checking, making sure the patient's okay, doesn't have any problems, no complications, no complications with the IV site. So slowly flush that. And then I don't actually have a disinfectant cap, but I'm going to use this as my disinfectant cap. So then I would take that off. I'm going to scrub the hub one more time. I'm going to put this on, and then I would document the medication administration immediately after giving the medication, and then I'm going to assess. That's not the last time I'll do an assessment, but I'll assess the last time right then for any complications at all towards the medication that was given, or the IV site. And I would make sure to report and record everything that I have done, and I would come back to check on the patient 10 to 15 minutes later. and I would make sure to report and record and document everything that I have done.